Hello, I'm Dr. Chowdhury. Welcome to FSMB Spotlight. Our guest today is Dr. Patricia King, Chair of the FSMB's Board of Directors. Dr. King is a renowned internist at the University of Vermont Medical Center and a professor of medicine at the Robert Larner College of Medicine at the University of Vermont in Burlington, where she also received her medical degree and training. The role of FSMB's chair has become a busy one, certainly in the last few years, and you've identified a few priority areas for the year, such as sexual harassment and boundary violations, social media and professionalism, artificial intelligence and machine learning, and the value of education about medical regulation. You also decided to personally lead the effort related to reviewing and updating our policies on sexual boundary violations. What prompted you to chair that yourself?
Well, I think first I should begin by saying that this is an incredibly important issue for our state medical boards and also for maintaining the public trust and public protection for our state boards. When we thought this year about the very visible cases of sexual misconduct that have taken place over the past few years, as well as a real uptick in the number of complaints the state boards are getting regarding sexual misconduct, it just seemed like this was the time for us to approach this issue. And despite having a policy done in 2006 by the Federation on the same subject, and it was really quite a good policy, but 12 years have gone by, the expectations of the public are very different, and it's just very important for us to readdress and emphasize this topic. So in putting together the work group, I decided to do a work group, and in putting that together, several people approached me and suggested, knowing my interest, that I chair the work group. So that was my green light. It isn't, though I should say that was just an important part of my decision making and helped in me pursuing the project as the work group chair. I will say the work group has been wonderful to lead. We have a group of state board representatives, executive directors from around the country. We have two wonderful subject matter experts. We met for the first time in August and had a great discussion, including reviewing our state board actions and hearing from our subject matter experts. And as a result of that meeting, we really realized the importance of bringing collaborators in on this project, that just as the regulators, we couldn't do all of this alone. We needed more people involved in very different aspects of medicine to help us lead the project and to really work toward a change in the culture. So we're looking forward to those next steps with our collaborators, and we're very excited about this project.
Very good. It certainly is a timely issue.
It's very timely, yes.
Tell me about the Ethics and Professionalism Committee. It just met today.
So this year we are taking a look at our social media policy. The board put together a social media policy in 2012 for guidance for the state boards in dealing with complaints that involved electronic communication and social media. And that was only 6 years ago, but that's really just in some ways, or in many ways, an eternity in regards to social media. We're reviewing that policy. We had a great meeting today. Again, we had state board representatives from the four corners of the country. We discussed our policy, we discussed new issues in social media, we reviewed the very positive aspects of the use of electronic communication and social media, not only in patient communication, but also in education. Again, I think we'll be finishing our report this year with some very positive aspects.
So one of the committees you chair is a very important one. It's the Composite Committee, which actually runs the USMLE program, essentially. And there have been some questions raised, as you know, about the Step 2 clinical skills exam. I know that the NBME, the FSMB, and the ECFMG as well are working on addressing as many of those issues as possible. What can you tell us thus far about what's being done?
It's important to know that this is the fundamental work of what a physician does every day, over and over again. And it's really very important for the boards to have confidence that the students are able to pass this type of exam. I think what's unique and especially important for the state boards and the public is that this is probably the best standardized test of communication and professional behavior that the students have. Again, that's been shown to be valid and reliable. So that's very important for the state boards, who really see a lot of complaints that center on communication. Exam is not perfect, and it's being continually worked on for improvement. Some of the, you asked me about what some of the issues were in terms of why people were frustrated with the exam. One is that I think some of the students felt that the schools could provide the examination on their own, and that the students would not have to travel to a testing center to take the exam. In reality, I think that while some schools might be able to do that, I think it would really be a burden and something that would be very difficult for many of the schools to do on their own with the same independence and non-biased approach, as well as the same validity and reliability quality assurance to the exam. So I think that that's an important point to bring up. Another issue that the students have brought up is cost. The exam is costly. We have to, or the ECFMG and the MBME have to maintain 5 different testing centers across the country, and the use of standardized patients. But I will say I know firsthand that there are always, the USMLE is always working to look for ways to minimize cost and certainly minimize any increases in cost. I think in balance, the value really is there for the state boards and for the public in assuring that this type of assessment has been done.
That sounds like more to come.
More to come, yeah,
Okay,
always.
Very good. So, Pat, final question. You're at about the halfway point in your chairmanship of the FSMB's board. What have you enjoyed so far, and what do you see ahead?
That's a good question. I've really enjoyed all of it. It's really been a wonderful opportunity for me. I think that the projects we're approaching this year are very exciting. I've talked about the work group on sexual misconduct. I've talked about a review of social media. But another very exciting project for me is our work to kind of look into the future of medicine and to look at the incorporation of artificial intelligence and those types of technologies and how that will impact medical regulation. So that's been very exciting. And as you know, tomorrow we have a summit conference on artificial intelligence for the state boards and some other partners in the industry and in private industry to speak together in a collaborative way on this topic. So that's been very exciting. My son is 27 and always talking about new technology, so I feel very excited to at least in some way be able to keep up with him in these lines of thinking. It's been really wonderful.
Here and around the world.
To meet people from medical boards across the United States, from people around the world. We have so many things in common despite a lot of the differences, but also to see people very committed to serving the public and to serving the profession. So it's been really wonderful and very inspirational to see all these people giving many hours of their time for such a great profession.
Thank you, Pat, for joining us, and thank you for your service to the nation's state medical and osteopathic boards.
Thank you, Hank.
Thank you for joining us. Stay well, and see you next time.